Health Cabinet Secretary Mutahi Kagwe says anyone implicated in the misuse of funds meant for the fight of COVID-19 pandemic will be dismissed with immediate effect. In an exclusive interview with NTV's Seth Olale Ali today, Kagwe has also announced that his ministry will streamline the managements of both KEMRI and National Influenza Laboratory centers to serve the key purpose of curbing the coronavirus pandemic. And now Seth joins us from Afia House. Seth, you had this very exclusive interview with the CS yesterday. He went on Facebook and posted his regrets that people are talking about misuse of these funds. And he lashed out at those people who he deems as trying to undercut his efforts in leading the fight against coronavirus. Seth, what else did he say?
Well, good afternoon, Dennis Okari, and indeed you did manage to introduce me after that exclusive interview. Yes, very tough words from the Cabinet Secretary. He's terming this as a distractor and saying that, you know what, in as much as it has made headlines, it is quite now in the public domain that, of course, Kenyans are raising eyebrows in regards to priorities taken, especially in the spending by the Ministry of Health. And he did say that anyone, and I repeat, found to have misused money meant for the fight against COVID-19 pandemic will be dismissed with immediate effect. And those tough words coming from the Cabinet Secretary for Health, saying that a detailed report is forthcoming in regards to the priorities taken by the authorities in regards to making sure that they contain this particular pandemic. Remember that today it is the 48th day since the first case was confirmed, but also the Cabinet Secretary for Health, Mutahi Kagwe, did mention politics that he termed as also derailment towards the fight against COVID-19. And he did say that his ministry will take decisive measures to ensure that it streamlines the agencies that have been implicated in politicking. And he did mention KEMRI, that is the Kenya Medical Research, and as well as the National Influenza Control Center. And he did say that, of course, there have been issues in regards to promotions and demotions, but he says that now the issues have been politically, and he says that political issues will be resolved politically, and he's terming this as a setback towards the ministry's concentration in fighting the pandemic. But even of essence is that in that exclusive interview earlier on, Dennis, that he did indicate that they will keep their eyes on the ball. They will not be distracted, and they will leave it up to the accounting officer in the Ministry of Health to come out clean and give the details in terms of which money was spent where, and any money that is unaccounted for, they will need answers to that. And anyone implicated in misappropriation of funds, decisive action will be taken against him, not only at the ministry level, but also in terms of looking at it as a criminal activity, and therefore involving the Directorate of Criminal Investigations. But even most importantly, he wants Kenyans not to drop guard against the fight against the COVID-19 pandemic, warning that this month is also going to be crucial for health authorities in monitoring the trends. We're talking about the measures undertaken since this particular pandemic was announced, talking about social distancing, talking about sanitization as well as fumigation, and of course we know that the curfew is still in force, and of course the travel restrictions are still underway in the 5 counties, that is Nairobi, Mombasa, Kwale, Kilifi, and lately Mandera counties. We're talking about cessation of movements, and so we expect another briefing today from the Ministry of Health. I know that they're planning to do it differently. They're trying out how they're going to relay daily informations differently. But even to get a clear picture of what the CS said in regards to cracking the whip on those fraudulent officials found to have misused ministry money towards the fight against pandemic, let's listen in to Mutahi Kagwe, the Cabinet Secretary for Health.
There is no COVID money that is going to be misused. And that you can take from me. We are not going to misuse COVID money. That is number one. And everything will be clarified completely. Yesterday, we even sat with our donors, and they agreed and they saw what we are saying. They are in fact encouraged us. They are adding us more money to fight the disease. That's number one. And number two is to say that not only are we going to remain transparent, but persons who make anything, anybody who touches a single cent from this COVID, will be dismissed. You know, we'll be moved out of the systems that we have got here.
Mutahi Kagwe, the CS for Health, who is expected to be part of today's afternoon briefing, but that will depend whether he himself will give that update or any other ministry, senior ministry official will do that. Dennis, even as I hand over to you, remember that earlier on there was also another very important event here at the Ministry of Health headquarters. We're talking about a partnership between the Nation Media Group and the Ministry of Health, and Nation Media Group, represented by the CEO, did say that it will continue doing its role in sensitizing and giving information about the measures that Kenyans need to undertake in regards to the fight against the COVID-19 pandemic. But also the Nation Media Group has announced that it will roll out a 2-month exclusive free issuing of online newspaper content to the frontline warriors in the war against COVID. We're talking about health workers. So for 2 months, all the health workers in this country will receive exclusive free online content courtesy of Nation Media Group and the Ministry of Health partnership. Back to you, Daniel.